planning grant, our team is diverse. I showed that picture at the beginning, and I have it again here. We have a combination of frontline clinicians, so 3 frontline dietitians, including myself. We have 2 home to feed users, John and Terry, and so they're located kind of on the right, upper, and bottom. We have Kea, who is a caregiver for John, and then we have also our academic partner of Dr. Kassam from UBC, and then some healthcare decision makers to help us really make sure we're making that relevant. And I can say working with this team has been such a joy. We really have been able to come together and respect each other's areas and areas of expertise and see a lot of really great planning, both from our research level, but also individual changes to our practice have already taken place for our frontline dietitians by just engaging with our patient partners from the beginning. And so as a team, we really determined that the question we wanted to explore were, what are the experiences and challenges of adults living at home with tube feeds? And the way we felt best to do this was through individual interviews. So as a team, we went through the literature to try and understand, just what are the current understandings of some of those experiences globally? There's not as much done in Canada in regards to home tube feed users, and very minimal, actually nothing in BC, and nothing for a diverse audience that we have. And so we looked at that, and then we, as a team, sat down and said, okay, well, what are the specific experiences we make sure we want to hit? And from that, we created an interview guide, so a specific set of questions to try and tease out what experiences and challenges people are living with. We went on to pilot those interviews, and so we conducted 3 interviews with 2 home tube feed users and 1 caregiver. And right now we're in the stage of just going over that data to make sure we feel like we caught the information we wanted to. We're going to tweak that interview guide a bit, and then we're just in the process of writing a few additional research grants to be able to fully scale this study to really get out there and ask the full population what are their experiences. And so I just wanted to share briefly some of the things we found as a team. These are very preliminary findings, and we don't have specific themes, so take it with caution. But these are some things that have been really meaningful to our research team as we've been reflecting. And so the first one is just this quote from a home tube feed user. Once I got used to the idea that you actually don't have to do tube feeding, at the same time every day. It's just like eating. Sometimes you're a bit hungry earlier. It was pretty easy. And so this for us was really just driving home that concept, and this is something our patient partners have reflected with us as well, is just as healthcare professionals, we sometimes can view things very medically. And for a lot of people, that shift away from the medical procedure to more of, it's just like food. It's like something I know is really meaningful. And then from our caregiver side, this was something we heard was, there's general support groups for anxiety, like more mental health things. But as far as caregiving for somebody with a chronic illness, I don't see those being provided. And so this helped, to identify some issues that are out there, and we look forward to exploring this more. What are some of the gaps in the healthcare system? And so these preliminary findings have led to some practical reflections for us as healthcare professionals already, and we've actually been able to disseminate some of these just initial reflections to our dietitian team for them to think more about when they're doing that home tube feeding teaching, what should we be focusing on? And so the first reflection we had was providing choices. So there's many different ways to provide tube feeds, and I won't get into it in depth, but you can use pumps or gravity, and those different options have different pros and cons. Sometimes dietitians will just come out and only talk about one option, and then people go home and learn about these different ways. And so enabling our home tube feed users to know the options, again, really helps remove that medical aspect to it and turns it more into that patient-centered care. The other thing is avoiding strict schedules. So as clinicians, we typically use a lot of numbers in the hospital. We have to say what time we're going to give that first feed because the nurses need to know. And traditionally, those numbers were then translated at home. We would say, at 8 o'clock you're going to have a feed, at noon you're going to have a feed, and at 5 p.m. you're going to have a feed. And upon reflection, our team really thought about the fact that if we're talking about food, we probably need to be using words more like breakfast, lunch, dinner, because it doesn't really matter in most situations whether you're having it exactly at 8 or 8:05. Like our participant reflected, it's just food. You may be hungry earlier. Go ahead and have that flexibility. And then the last reflection we had is just encouraging social support. Traditionally, that's not something as dietitians we would have brought up in our home to feed teaching. And there are some limits to those supports that are out there, which is, as I build on things we'll look to do hopefully in the future as we hear more from a population. But just bringing this into the conversation with your patients is mentioning that and recognizing that social support's probably needed. And so getting people to reflect and be mindful of what that would look like for them. So again, these are just some of the outcomes that we've seen already of just doing that small pilot study as we go forward. And so if we're thinking of that original idea of finding the population, talking to the population, which as I highlight here really is ongoing. We by no means think we're done doing that. But ultimately creating patient-centered programs, we have been able to see some really great outcomes already. Fraser Health has been responsive to that original data, the numbers data, and they actually came out and created 2 new home health dietitian positions in traditionally underserved areas. So Langley and Surrey didn't have those positions before. Upon reflection, though, as I've been writing some of my grants, it's great to see the health authority move on these things, and I applaud their readiness. But it'll be curious to see, given that these were created without us talking to the population yet, how our recommendations likely will change as we hear more about what it actually are the express needs of this population. And so the impact of these direct positions, may or may not be limited based on how well we're meeting those needs. And so that's why, we're going to keep moving forward. More advocacy needs to take place as we hear more from our population. And so that really brings me to where we are today. So we're really still in that bottom end. We have a better understanding of our population, but we're really needing to continue our research, understanding the express needs. And so that's where our research team that I showed earlier are continuing with us. Our patient partners have agreed to continue on with our research, and we really value that. Their expertise and experience really has been invaluable. And then also as we move forward, we've been reflecting with some of their suggestions about thinking about how we share our findings, going out and sharing with the population and actually asking them as they reflect on the needs they hear of their colleagues is what do they suggest the programs will look like? And so again, really involving end users. I think we sometimes think of knowledge translation and we just want to rope those people in at the end. But having our patient partners be a voice the whole way through, I think really gives us the ability, again, to create those evidence-based programs from the beginning that really focus on our patients. So again, if there's researchers out there, I would really encourage you to reflect on incorporating patient-oriented research into what you're doing. And so I just want to highlight some key supports that have been really great for us that I would recommend to any researchers. Or if you're a patient listening to this and want to get involved, these are great people to help identify researchers who are looking for people. The first one is the BC Support Unit. And again, I can't speak highly enough of the opportunities they have both for researchers and patient partners in training and expertise. And I believe there's local units across the province, so finding one that's near you. And then the Patient Voices Network is someone else who we've worked with. They were really great at recruiting and orienting our patient partners. It's been helpful for me as the team lead to know that my patients have someone to support them. We have, again, I can't speak highly enough of our patient partners. They're really great people. They come to the table with really meaningful insights. They think outside the box. But I know at the end of the day, sometimes us in the health authority, we view things a specific way, and so knowing that they're supported with some outside support through Patients Voices Network has just helped me feel that much more confident in having our patients supported. So yeah, so again, I would just encourage researchers to reflect on that, and if you have a need, reaching out to these different resources. So that kind of ends my formal presentation. My goal was to be short and sweet, so we have some time for questions, or I do appreciate it's lunch, and I'm a dietitian, so I'm mindful of that. But I just want to thank again the BC Support Unit for everything they've done up until this point and ongoing. Our team has really deeply appreciated that. And we, as a team, have also been given the opportunity over this next year to actually get some additional training in patient-oriented research. There's a fellowship that we've been awarded, and so that's something both myself and my patient partners will be doing over the next year for us to continue to be more of an expert in that. Also, within Fraser Health, we have a wonderful research and ethics department. There is an amazing team there that really, without it, none of this would get done. Yeah, just really great experts, and I appreciate everyone there. And then the students that did a lot of that initial work, and then our final team members. I could go on for a while, but for the sake of time, I will leave the names up there and give a thank you out. And if I miss someone, I do apologize. There's been a lot of teams and people that have really supported us in this whole journey.